Hi, I'm Jennifer Harrison, social worker and chemical addictions counselor and faculty member here at Western Michigan University in the School of Social Work. And I want to talk to you about a grant-funded program to impact behavioral health workforce in Southwest Michigan called iPeer. It's the Interprofessional Peer Education and Evidence for Recovery program, and some of the ways that you might be able to be involved. So first of all, I want to talk about the current state of behavioral health treatment and why we want to impact that. Sometimes, even though we talk about wanting to work interprofessionally, there are often situations where in behavioral health and other forms of healthcare, we're really operating in separate silos. And so you might have one provider who's a social worker who's operating in one silo and helping an individual, and then another person who's an occupational therapist who's maybe working in another silo, and then another person who's a peer support professional who's working in another silo. And that gives our clients and our systems of care the impression of a real sense of disjointedness. And so one of the things that we want to do when we're talking about interprofessional care is to really join these three silos. And that's part of what iPeer seeks to achieve. So individuals that are eligible for iPeer are two types of graduate students. First of all, social work students that are in our concentration or specialist placement. So that's typically the last field placement that people have in their MSW program. Masters of Science in Occupational Therapy students that are in one of their two level 2 field placements in a behavioral health setting, which again is their last set of field placements before they graduate and join the field, and peer support partners, which are individuals with lived experience with their own illness and recovery from a behavioral health condition, and who have also received certification and training from the state to be eligible to practice as peer professionals within interprofessional teams, or sometimes solo as individual peer support providers. So what we do is we join these three types of professionals in these three disciplines together in the iPeer program. And they engage in a series of 3 activities over a minimum of 6 months and a maximum of 9 months of participation. The first activity is that all 3 types of these professionals are involved in weekly interprofessional peer supervision. So that takes place every week for about 2 hours and involves case consultation, a discussion of shared disciplines, and shared research that they're involved in, as well as support for one another in their professional development. The second strategy that we use are specialty trainings on topics including opiate use disorders, goal attainment scaling, motivational interviewing, recovery narratives, and peer support services. And those are available not only for our student and peer support participants, but also for their field instructors and others throughout the community. They're always available for free. They have free continuing education units, and they're available as part of the iPeer grant program. The third feature that we have our iPeer participants engaged in is shared research on an interprofessional basis. So teams of students and peer supports engage in interprofessional research and develop a poster presentation that's delivered at one of our interprofessional occasions here at the College of Health and Human Services. Those same research initiatives or poster projects can also be used for statewide, national, or even international presentations that our participants would like to give, and that this poster, this shared research, is kind of a launch for them. So in order to qualify for the iPeer program, students, so our MSW and our MSOT students, as well as our peer support partners, need to be in a field placement or practicing, in the case of peer support partners, in one of 10 counties in rural and medically underserved Southwest Michigan. So we've got a 10-county region, and they need to be practicing. Here, we're going to see if we can get that to show up a little bit better. So they need to be practicing at either a community mental health provider or part of the community mental health provider network. So for instance, we've got placements in Allegan and Ottawa County at the community mental health, as well as in Ottawa County at Holland Hospital in their behavioral health unit. We've got placements in Berrien County and Van Buren County, as well as Cass County and St. Joe at the community mental health site, and then at the community mental health site Summit Point in Calhoun County, as well as Fieldstone Hospital. In Kalamazoo, we've got several different placements, and in at Kalamazoo Psychiatric Hospital, working with the Goal Attainment Scaling Project directly at Borges One North in their Behavioral Health Emergency Department, at Interactive Michigan, etc. In Allegan County, we've got placements at Michigan Career and Technical Institute, with Allegan Community Mental Health, and with Sensory Systems, a program for youth and adults with autism and other spectrum disorders. And then in Branch County, we've got a placement with Pines Behavioral Health Network. So any of these qualifying placements allow students and peer support partners to consider committing to the iPeer program. One of the huge benefits, we're actually going to do this in green because it's super important, is that students, so our MSW and our MSOT students that participate in a full 6 months of the iPeer program qualify for a stipend of $10,000. That's given in 2 equal allotments at the beginning of each semester of participation, and goes directly to your student accounts. HRSA, which is our funding body, is very specific about requiring that 60% of the resources for the grant are specifically dedicated to these stipends provided to students. So hopefully we have our link for the iPeer website down below here. If you are interested in hearing more information about the program or of attending any of the programs, do feel free to contact myself or my co-principal investigator, Ann Chaplow, at our emails, which are listed below. And thanks so much for your interest.